Drugs affecting the respiratory system for UNIKL, RCMP, B-Pharm Principles of Pharmacology students. This video will guide you through the essential KKN registered drugs that affecting the respiratory system, equipping you with the knowledge you need to excel in your pharmacy studies. Let's dive in. The respiratory system is vital for gas exchange, delivering oxygen and removing carbon dioxide. Understanding its function is crucial for comprehending respiratory disorders. Common respiratory disorders include asthma, upper and lower respiratory infection, sinusitis, pharyngitis, laryngitis, pneumonia, chronic obstructive pulmonary disease, COPD, allergic rhinitis, and cough. These conditions significantly impact patients' quality of life. Pharmacological management plays a critical role in treating these respiratory conditions. Effective drug therapy can alleviate symptoms and improve patient outcomes. Drugs affecting the respiratory system are classified based on their mechanisms of action. This classification helps in understanding their therapeutic uses. Common classifications include 1. Bronchodilators, 2. Anti-inflammatory agents, 3. Drugs affecting mucus like expectorants and mucolytics, and 4. Antitussives, and finally 5. Drugs used for allergic rhinitis and upper respiratory tract infections. Each class targets different aspects of respiratory function. Understanding these classifications is essential for selecting the appropriate drug for a specific condition. This ensures optimal patient care. Firstly, bronchodilators are medications that relax the muscles in the airways, widening them. This makes breathing easier for patients with respiratory conditions. Bronchodilators are a cornerstone in the treatment of asthma and COPD. They provide quick relief from bronchoconstriction. There are several types of bronchodilators, each with a unique mechanism of action. These include beta-2 adrenergic agonists, anticholinergics, and methylxanthides. Beta-2 adrenergic agonists are a common type of bronchodilator. They are often used as first-line treatment for acute bronchospasm. Examples of beta-2 adrenergic agonists include salbutamol and salmeterol. Salbutamol is short-acting, while salmeterol is long-acting. These drugs work by stimulating beta-2 receptors in the lungs. This stimulation leads to relaxation of the bronchial smooth muscle, resulting in bronchodilation. Beta-2 adrenergic agonists are indicated for asthma and COPD. They provide relief from wheezing, shortness of breath, and chest tightness. Contraindications for beta-2 adrenergic agonists include tachycardia and hypersensitivity. Patients with these conditions should use these drugs with caution. Anticholinergics are another class of bronchodilators. They are particularly useful in treating COPD. They work by blocking the action of acetylcholine on muscarinic receptors in the airways, leading to bronchodilation and reduced mucus secretion. Examples of anticholinergics include ipratropium and tiotropium. Ipratropium is short-acting, while tiotropium is long-acting. These drugs work by blocking muscarinic receptors in the airways. This reduces bronchoconstriction and mucus production. Anticholinergics are indicated for COPD and asthma. They help improve airflow and reduce symptoms. Contraindications for anticholinergics include glaucoma and urinary retention. These conditions can be exacerbated by anticholinergic effects. Methylxanthanes are a less commonly used class of bronchodilators. They have a narrow therapeutic index. An example of a methylxanthine is theophylline. Theophylline requires careful monitoring due to its potential for toxicity. These drugs work by inhibiting phosphodiesterase, leading to bronchodilation. They also have anti-inflammatory effects. Methylxanthanes are indicated for asthma and COPD. However, they are often reserved for patients who do not respond to other treatments. Contraindications for methylxanthines include arrhythmias and seizure disorders. These conditions can be worsened by theophylline. Secondly, anti-inflammatory agents reduce inflammation in the airways. This helps to control chronic respiratory conditions. These agents are crucial in managing asthma and COPD. They prevent airway narrowing and reduce exacerbations. Common anti-inflammatory agents include corticosteroids and leukotriene modifiers. Each class has a different mechanism of action. Corticosteroids are potent anti-inflammatory drugs. They are available in inhaled and systemic forms. Examples of corticosteroids include beclombethasone, budesonide, prednisolone, and methylprednisolone. These corticosteroids are commonly used in asthma management. These drugs work by reducing airway inflammation. They suppress the immune response and decrease mucus production. Corticosteroids are indicated for chronic asthma and COPD exacerbations. They help to control symptoms and prevent long-term damage. Contraindications for corticosteroids include systemic fungal infections. These infections can be worsened by the immunosuppressive effects of corticosteroids. Leukotriene modifiers are another class of anti-inflammatory agents. They are often used as add-on therapy in asthma. An example of a leukotriene modifier is montelukast. Montelukast is available in oral form, making it convenient for patients. Leukotriene modifiers are indicated for asthma prophylaxis and allergic rhinitis. They help to prevent symptoms and improve quality of life. Contraindications for leukotriene modifiers include hypersensitivity. Patients with known allergies to these drugs should avoid them. Monoclonal antibodies are a newer class of drugs used to treat severe allergic asthma. They target specific components of the immune system. An example of a monoclonal antibody is omalizumab. Omalizumab is an anti-IgE therapy. These drugs work by binding to IgE, reducing the allergic response. This helps to control asthma symptoms and reduce exacerbations. Monoclonal antibodies are indicated for severe allergic asthma. They are reserved for patients who do not respond to other treatments. Contraindications for monoclonal antibodies include hypersensitivity. Patients should be monitored for allergic reactions after administration. Antitussives and expectorants are used to manage cough. They have different mechanisms of action and are used for different types of cough. Antitussives suppress cough, while expectorants help to clear mucus. Understanding their uses is important for effective cough management. These drugs are commonly used in over-the-counter cough and cold remedies. However, they should be used with caution. Antitussives are used to suppress dry, non-productive coughs. They work by reducing the cough reflex. Examples of antitussives include dextromethorphan and codeine. Dextromethorphan is a non-opioid antitussive, while codeine is an opioid antitussive. These drugs work by acting on the cough center in the brain. They reduce the urge to cough. Antitussives are indicated for dry cough suppression. They provide relief from persistent coughing. Contraindications for antitussives include respiratory depression. For opioids, opioid antitussives should be used with caution in patients with respiratory problems. Expectorants help to loosen and clear mucus from the airways. They are used for productive coughs. An example of an expectorant is guaifenesin, ammonium chloride, and Linctus. They are commonly found in over-the-counter cough syrups. These drugs work by increasing the volume and reducing the viscosity of mucus. This makes it easier to cough up. Expectorants are indicated for productive cough. They help to clear the airways and relieve congestion. Decongestants are used to relieve nasal congestion. They work by constricting blood vessels in the nasal passages. Examples of decongestants include pseudoephedrine and phenylephrine. They are available in oral and nasal formulations. These drugs work by causing vasoconstriction in the nasal mucosa. This reduces swelling and congestion. Decongestants are indicated for allergic rhinitis and the common cold. They provide relief from nasal stuffiness. Contraindications for decongestants include hypertension and glaucoma. Proper inhaler technique is crucial for effective drug delivery. Patients should be educated on how to use their inhalers correctly. Overusing short-acting beta-agonists, SABAs, can lead to tolerance and mask underlying inflammation. This can result in poor asthma control. We've covered major drug classes affecting the respiratory system, including bronchodilators, anti-inflammatory agents, and antitussives. Remember to focus on their mechanisms, indications, and contraindications. Continue your learning journey by exploring further resources and clinical guidelines. Your dedication will make you a knowledgeable and effective pharmacist. Now that you've gained valuable insights into respiratory pharmacology, take the next step. Download our PDF study notes and share this video with your fellow pharmacy students. Let's ace those exams together.